You sent us something recently that really caught our eye. It was about Ayurveda and, this ancient Indian system of medicine. And it was about infections and diseases. And what really stood out was just the different perspective that it offers, especially compared to like the modern Western medicine approach, how we often just think about specific pathogens.
Right.
So in this deep dive, we're going to take a look at some of the core principles of Ayurveda as presented by Dr. Vaidya Mahesh Sabade. And I'm just going to call him Dr. Sabah
Sure.
for simplicity. And he gave this presentation, and it was at a CAAM talk. So it seems like he's interested in bringing like these two worlds together and really seeing how this ancient wisdom kind of views and addresses illnesses that we're pretty familiar with in the modern world. And we're hoping it'll give you like a different and maybe even eye-opening way to think about health.
Yeah, absolutely. And I think it's important to point out that Dr. Sabad is not just like a, casual observer of Ayurveda. He is like fully immersed in it. He's an MD in Ayurveda.
Right.
Researcher, practitioner, teacher, speaker. He's affiliated with Agnivesh Ayurveda. He's an honorary Ayurveda consultant at the Health Center at Pune University.
Wow.
And Pune.
Yeah.
And he's also faculty at Ananda Ayurveda Academy in Chicago. So he's like really bridging that traditional knowledge with contemporary understanding, I think.
Yeah, that's amazing. It's so cool that he's like teaching that in Chicago too.
Yeah. Yeah.
So from the beginning of his presentation, one thing becomes really clear. Ayurveda offers a really like holistic perspective. It's not just about finding the, one specific bacteria or virus. It's much broader than that. It's looking at the body's own internal environment.
Yeah.
So what are the core concepts, like in Ayurveda, that shape its understanding of like why we get sick in the first place?
Well, the way Dr. Sabat explained it, Ayurvedic pathology is really all about this web of connections within us.
Yeah.
And it looks at the three doshas. Think of those as kind of fundamental energies that govern our body. And those are Vata, Pitta, and Kapha. And those relate to like movement, transformation, and structure.
Okay.
And then you also have the seven dhatus, which are other body's tissues. You have the malas, the waste products, and also, crucially, the mind and soul. So in Ayurveda, these aren't separate entities. They're all constantly interacting and dependent on each other.
Right.
And one of the, interesting things he pointed out is often like the first domino to fall, on the path to disease is Agni.
Okay.
Which is our digestifier.
Like the digestifier.
Yeah.
Okay, so how does a, sluggish digestive system or, kind of a weakened Agni set the stage for illness?
So imagine your digestive system as a furnace.
Okay.
And when Agni is strong, it's burning bright and it's efficiently breaking down food, providing nourishment and energy.
Right.
But when it's weak, which Ayurveda calls Agnimandia, that process is not as complete. So then you start to get this accumulation of what's called Agni.
Okay, ayam.
And ayam is not just like indigestion. It's really like this buildup of metabolic waste or like partially digested material that your body can't properly use. And Dr. Sabate pointed out this ayam often accumulates in the amashai, which is the steak. And it actually further dampens Agni. So it creates this kind of downward spiral.
Oh, wow.
So as the Agni weakens and the ayam builds up, the doshas, which remember are Vata, Pitta, and Kapha, they become imbalanced, or as they say, vitiated. And at the same time, this like impaired Agni and all this ayam is preventing the proper nourishment of the dhatus.
Right.
So your tissues become weaker, and then they're more vulnerable to disease.
Okay, so it's like a chain reaction. Starts in the gut, weak digestion creates this internal, sludge, this ayam, and that throws off the body's fundamental energies, the doshas, and weakens our tissues.
Right.
And then, as Dr. Sabata said, the key principle is that when those imbalanced doshas find a weak spot in the tissues, in the dhatus, that's when disease actually manifests.
Right.
So maintaining that internal harmony of Agni, doshas, and dhatus is really central.
Yeah, exactly. And that's like one of the key things to understand how Ayurveda views infections, which is different than just the simple germ theory that we have in Western medicine. And Dr. Sabat used the example of Jwara or fever to highlight that difference.
Right. So in Western medicine, we say, okay, you have an infection, your body is going to raise its temperature to try to fight it off.
Right.
But how does Ayurveda see it?
It's not just a reaction to like an external bug. It's really viewed as a manifestation of these internal imbalances. So for a fever to take hold, you generally have that weak digestion, that agnomandia,
right,
leading to the awry and that buildup. You have an imbalance of doshas, and then you have a weakness in the rasa dhatu,
okay,
which is the primary tissue that's responsible for nourishment. And he made the point that a strong, healthy Rasa Dhatu, what they call Rasa Sar, can actually prevent a fever from developing, even if someone is exposed to an infectious agent.
Wow. So it's more about the body's ability to withstand that. It's not just about blaming it on the germ.
Exactly. It's about the resilience.
Right.
And he also talked about Agantu Jawara, which is like a fever caused by external factors.
Okay. How does that fit in?
So it acknowledges that, yes, external factors like extreme heat or an injury can trigger a feverish response.
Right.
But even in those cases, the underlying strength and the balance of the body's internal constituents, particularly the dhatus, plays a crucial role in how you react.
Right.
So for example, if your Rasa Dhatu is really robust, your body's natural regulatory mechanisms are going to be better equipped to handle those stressors without going into a full-blown fever.
Wow.
So unless that Dhatu is already weakened or vulnerable, that external factor alone may not be enough to actually cause the disease.
Yeah.
So even with, exposure to something like a virus,
Yeah.
someone with strong underlying health, according to Ayurveda, is less likely to actually succumb.
Right. Than someone who's kind of, already a little bit depleted.
Exactly.
Yeah. Okay. So this idea that the body's internal environment is like the primary determinant is really a cornerstone of the Ayurvedic perspective on all kinds of diseases. And he gives some specific examples too. So let's kind of dive into those.
Yeah.
Starting with tuberculosis. And it's known in Ayurveda as Rajakshma.
Right.
So, from our Western medical standpoint, tuberculosis, TB, is a bacterial infection. It's caused by Mycobacterium tuberculosis.
Right.
And it's a serious global health issue. And even in the U.S., in 2023, there were almost 10,000 cases reported. So, pretty big. And so in Western medicine, the focus is really on identifying the bacteria through testing and then using antibiotics to eradicate it. But Ayurveda sees it kind of differently, right?
Yeah, very differently. So it's called Rajakshma, which means king of diseases, which is kind of a dramatic title.
It is, right? Why is that?
Yeah, and I think that name really reflects the profound impact that TB has on the body. It's not just the lungs. It's considered to be a severe depletion of all the dhatus. And it often starts with the Rasa Dhatu, which again, that nourishing tissue that we talked about. And then it can kind of cascade through all the other tissues, even affecting the reproductive tissues, the Shukra Dhatu.
Wow.
And the key point that Dr. Sabade made is that this imbalance of Agni and the resulting depletion of the body's vital tissues is considered more fundamental to Rajakshma than the presence of the bacteria itself.
Wow.
So it's like the weakened soil that allows the seed of the infection to take root and flourish.
I love that analogy, the seed in the soil. That's really kind of paints a picture.
Yeah.
So the Ayurvedic treatment then is not just about attacking the bacteria, right? It's about revitalizing the soil.
Exactly. The primary focus is on rejuvenating those depleted dhatus, strengthening the body's natural immunity, and reigniting Agni.
Right.
Both the Jatharani, the digestive fire, and the Datvani, the kind of metabolic fire within each tissue.
Okay.
And as those fires regain their strength, they can support the nourishment and replenishment of those dhatus.
Yeah.
He also pointed out that while lung involvement is the most common form of TB, Ayurveda sees that whole respiratory system, the pranavaha srotas, as being particularly vulnerable when the other dhatus are weakened, and the vata dosha, the energy of movement, is aggravated.
Right.
And he also mentioned, integrating this approach with conventional anti-TB treatments. So kind of combining those medicines with the Ayurvedic medicines can lead to better outcomes because you're addressing the infection and bolstering the patient's health at the same time.
Wow.
So it's not just about killing the bacteria, it's about restoring the body's inherent vitality and resilience.
So it's really like creating an internal environment that's no longer welcoming.
Right.
Even if the bacteria is still there. Okay, let's talk about krumi, which is what we would call parasite infections, worm infestations. So in Western medicine, we're trying to identify, exactly what type of worm it is, and then use medications to target and eliminate it. But again, Ayurveda has a slightly different perspective.
Yeah. It's really about the internal environment again. So rather than focusing on just what species of worm it is, the Ayurvedic understanding is that it's an imbalance that's characterized by the accumulation of kapha and klita,
Okay.
which is excess moisture, mucus, kind of a general sluggishness within the body, particularly in the digestive tract. And this environment just makes it really, really easy for parasites to thrive.
Ah, okay. So the Ayurvedic treatment strategy then is aimed at making that internal environment less inviting.
Exactly. So the approach is strengthening Agni to improve digestion and metabolism and reducing the excess kapha and klita.
Hmm.
And he mentioned traditional use of herbs like Vedanga, Vacha, and formulations like Vedangarishta, which can help do that. So by kindling the digestive fire and reducing that damp kapha environment, you're basically making it inhospitable to the parasites.
Wow. Okay, so it's not just like taking the pill to kill the worm. It's about making kind of fundamental shifts within the body.
Right.
Now, what about viral infections? He talked about a range, the common cold, chickenpox, measles, COVID-19, hepatitis.
Right.
So how does Ayurveda approach those?
Well, when we look at things like the common cold, which Ayurveda calls pradashe, the focus is on the doshic imbalance again. And that's primarily an aggravation of kapha and vata doshas.
Okay.
So it's not just about, oh, you have a runny nose and congestion, body aches. It's like, okay, what are the underlying causes? And that can be things like exposure to cold or consuming foods that have a cooling energetic effect.
Right.
So it's really about, using warming herbs and making lifestyle adjustments to address those imbalances.
Right.
And he actually shared a fun fact. He mentioned there was a 1932 U.S. patent for a scarf that was designed to prevent colds and sinusitis.
Wow.
So this idea of protecting against cold exposure wasn't completely absent from, Western thought.
Even before the germ theory was fully, developed and accepted.
Yeah.
That's really cool. So what about like the more kind of childhood viral illnesses like chickenpox and measles,
Right.
which Western medicine usually sees as fairly minor, self-limiting?
Right.
What does Ayurveda say about those?
Well, Ayurveda, especially the lens of Panchabaltic Chikitsa, which is Dr. Sabade's lineage, offers a more nuanced view.
Okay.
So these conditions are seen as pitta disorders that specifically involve certain dhatus. So it's Mansa Dhatu, which is the muscle tissue in the case of chickenpox,
Okay.
which is why you see those eruptions on the skin. And then it's the Rakta Dhatu, the blood tissue, in measles,
Oh, okay.
and which is why you have that reddish rash.
Okay, that makes sense.
Yeah, and that high fever and that outward expression of the rash is seen as a manifestation of this intense internal heat that's generated by that aggravated pitta.
Okay.
And that heat can actually weaken the underlying dhatus and organs. So the Ayurvedic treatment is focused on gently cooling the body and pacifying pitta using herbs that are known for their cooling properties.
Yeah.
So things like turmeric, gyric, pravalpishti, parpathadikata, and chandanasav.
Wow. Okay.
And he also talked about Rasyana Chikitsa,
Rasyana.
which is rejuvenation therapy, and that's done after the acute phase to help restore the strength of the affected dhatus.
Okay. And what about herpes or shingles, which, we know is caused by the same virus that causes chickenpox,
Right.
the varicella zoster virus?
So in Ayurveda, it's known as Visarpa, and there can be variations based on which dosha is dominant.
Right.
But it's primarily considered an aggravated pitta that's affecting the Rakta and the Mansa Dhatu. So the blood and the muscle tissue, which is why you have those painful skin lesions. And he mentioned things like chronic indulgence in pitta-increasing foods and lifestyle choices over time as being kind of significant underlying causes. And the treatment approach is using pitta-pacifying herbs to cool that heat and address the vitiated doshas.
Right.
He also noted that if that pitta isn't properly and thoroughly pacified, you have a higher chance of recurrence and lingering weakness or nerve pain.
Okay, so you really got to address it fully. Now, COVID-19, it's a new virus, so it's not something that's, mentioned in these old Ayurvedic texts. So how does Ayurveda approach something like that?
Right. So Dr. Sabade explained that while it's not specifically mentioned, the principles can still be applied. So given its inflammatory nature, Ayurveda views it as primarily an imbalance of pitta and vata.
Okay.
So the treatments focus on pacifying those doshas.
Right.
And he mentioned using herbs like mangishta, which is known for its blood purifying and anti-inflammatory properties, and also aloe vera, which is cooling and soothing, just to kind of manage those symptoms and support recovery.
Okay, cool. And lastly, hepatitis, which we know is often caused by a virus as well. How does Ayurveda understand and treat that?
Right. So while acknowledging that viral infection, Ayurveda really sees it as an imbalance involving the Rakta Dhatu, the blood tissue, pitta, and the liver. So the Ayurvedic approach is to pacify pitta and to improve the function of the liver.
Right.
Particularly its role in processing pitta and kind of directing it appropriately.
Okay.
And he talked about how specific Ayurvedic herbs have been shown to be really effective in supporting liver health. They've seen improvements in liver enzymes, reductions in viral load like in hepatitis B, and an overall restoration of liver function.
Wow. So again, consistently, Ayurveda is looking beyond the specific, external cause
Yeah.
and really emphasizing the body's internal state as the key factor, both in terms of how susceptible you are and how you recover. And he makes a point that this unique perspective allows Ayurveda to address all sorts of health challenges, even contemporary ones, by focusing on restoring balance to those bodily constituents,
Yeah.
the Agni, the doshas, the dhatus, and malas.
Right.
And he talks about Ayurveda's concept of pramana, or valid sources of knowledge. Can you explain that a bit more?
Yeah. So Ayurveda relies on a variety of ways of knowing, including direct observation, pratyaksha, logical inference, and anumana, and also the wisdom that's passed down in these authoritative texts,
Right.
aptopadesha.
Okay.
And this is kind of a broader approach compared to Western medicine's more exclusive reliance on empirical observable evidence.
Right.
And Dr. Sabade argues that this broader approach, this epistemology, allows Ayurveda to address a wider range of issues, even those that aren't in those ancient texts,
Yeah.
just by focusing on those underlying principles of balance.
Right. Right. And he also brought up this kind of interesting historical interaction between Louis Pasteur, the father of germ theory, and Claude Bernard, who's a champion of the internal environment. And specifically, Pasteur's statement, the microbe is nothing, the terrain is everything.
Yeah, that was a really powerful point that he brought up. And I think it's amazing because while Pasteur established the germ theory, this statement that he made later in his life, really aligns with the Ayurvedic perspective.
Yeah.
So while being exposed to pathogens is a factor, it's really the underlying health and the internal conditions that are the ultimate determinants of whether or not you get sick.
Right, right. And so Ayurveda, by focusing on strengthening those dhatis and creating balance, is essentially creating that resilient terrain
Exactly.
that can resist disease. So I think, to sum it up, Ayurveda offers a really different but potentially complementary way of understanding health and disease.
Yeah.
And it puts this primary emphasis on the body's internal equilibrium, that interplay between Agni, doshas, dhatus, and malas.
Right.
And that is central to both preventing and treating illness. And while it doesn't ignore pathogens, it really focuses on fortifying the body's own resilience and creating an environment that's not conducive to disease.
Exactly. And as Dr. Sabade explained so well, understanding disease through that Ayurvedic lens allows for a more holistic and potentially more effective approach to healing. And while Western medicine is important, especially in acute and severe infections, Ayurveda really provides this timeless perspective.
Right.
That underscores our body's own innate ability to maintain health.
Right.
And, to be fair to Dr. Sabade, he also mentioned his lineage. He expressed his gratitude to his gurus, Vaidyanraj Prashant Suru and Prahatya Ratna, Vaidyanraj Jatatar Shastri Ji,
Okay.
just highlighting that depth and the continuity of this ancient wisdom.
Yeah. So I think, to our listener, take a moment to consider how this perspective that puts so much emphasis on internal balance and your body's own resilience, how might that influence your own understanding of your health and well-being? And this leads to a final thought. So given Ayurveda's focus on this healthy internal environment, what implications does that have for preventative strategies, beyond just trying to avoid germs?
Right.
How can you nurture and strengthen that soil within yourself to really foster greater health and vitality?
Yeah, that's the question.
Yeah, that's a question to think about.
Yeah, that's something to explore.
Definitely.